Did you know that your daily coffee habit could be protecting your prostate or making things worse? Stick around to discover the surprising effects coffee has on your prostate health and how to maximize its benefits while avoiding the risks. Research has extensively explored the relationship between coffee consumption and prostate health, revealing both beneficial effects and potential adverse effects. Studies on black coffee and prostate cancer suggest that drinking 6 or more cups per day may reduce the overall risk of prostate cancer by nearly 20%. This protective effect is even more pronounced for aggressive prostate cancer, with up to a 60% reduction in risk. Men consuming 1 to 3 cups daily also benefited, experiencing a 30% lower risk of developing aggressive forms of the disease. Before we go further, it is important to mention that these benefits are attributed to the antioxidant compounds found in coffee, such as flavonoids and polyphenols, rather than caffeine itself. Similar reductions in prostate cancer risk have been observed in men who opted for decaffeinated coffee, emphasizing the role of these beneficial compounds in prostate health. Consuming too much caffeine daily can cause or worsen insomnia. Too much caffeine may also cause irregular heartbeats, headaches, and irritability. Additionally, coffee acts as a diuretic, causing your body to expel more water. As a result, it may lead to dehydration if you don't ensure adequate water intake to balance its effect. It is also important to note that pure and organic coffee is what's recommended. Most commercial coffee brands contain pesticides, herbicides, and mold toxins, which are damaging to health, including the prostate gland. In this video, we will dive into the positive and negative effects of coffee on prostate health. At the end, we will provide some tips on how to use coffee to boost your prostate health. Here's something you might not know. Coffee's antioxidants could help lower your risk of prostate cancer, but overdoing it might be harmful. Let's break down how to find the perfect balance. Let's begin with the negative effects. 1. Worsening benign prostatic hyperplasia (BPH) symptoms. Men with BPH, or an enlarged prostate, often face challenging urinary symptoms such as frequent urination, urgency, and discomfort. These symptoms can worsen with caffeine intake because it acts as a bladder stimulant, increasing urinary frequency and causing irritation. For men with BPH, this can lead to disrupted sleep, difficulties in daily activities, and a reduced quality of life. Additionally, caffeine's diuretic effects may intensify these issues by promoting water loss and bladder sensitivity. To alleviate these symptoms, reducing coffee consumption or opting for decaffeinated alternatives may help provide relief while still enjoying warm beverages. 2. Prostate irritation. Excessive caffeine consumption, typically more than 4 or 5 cups a day, can irritate the prostate and surrounding tissues, particularly in men prone to prostatitis, which is an inflammation of the prostate gland. This irritation may result in discomfort in the pelvic area, painful urination, or even burning sensations during urination. Over time, repeated irritation can contribute to chronic inflammation, potentially worsening existing prostate conditions. Men with sensitive prostates or a history of prostatitis may benefit from moderating their coffee intake or switching to non-caffeinated drinks to reduce the risk of aggravating their condition. 3. Hormonal impact. Coffee can influence hormone levels such as testosterone and estrogen, which are directly tied to prostate health. While moderate coffee consumption is unlikely to cause significant hormonal shifts, excessive intake might subtly alter these levels, potentially impacting the growth or health of prostate tissue. For example, imbalances in testosterone may contribute to the progression of benign prostatic hyperplasia (BPH) or other hormonal conditions. Since the effects of coffee on hormones vary between individuals, men concerned about hormonal changes should consider limiting their coffee intake and seeking professional advice if they experience symptoms of imbalance. 4. Risk of dehydration. Coffee's diuretic properties encourage the body to expel more water through urination, increasing the risk of dehydration if water intake is not properly maintained. Dehydration can negatively affect the urinary system by making the urine more concentrated, leading to bladder irritation and heightened discomfort. For men with prostate conditions like BPH or prostatitis, this can exacerbate symptoms and make the condition harder to manage. Maintaining proper hydration is essential to reduce inflammation and promote a healthy urinary system, so balancing coffee consumption with plenty of water is critical for men with prostate concerns. Before we dive into the list of positive effects, we'd greatly appreciate your support by liking this video and subscribing to our channel. Your engagement signals to YouTube to share our content with more viewers, helping us grow and reach a wider audience. Thank you for being a part of our journey. Here are the top 5 potential beneficial effects of coffee on the prostate. 1. Reduced risk of prostate cancer. Research suggests that moderate to high coffee consumption, ranging from 3 to 6 cups per day, may significantly lower the risk of developing advanced or aggressive prostate cancer. This protective effect is attributed to the high levels of antioxidants and anti-inflammatory compounds found in coffee, such as polyphenols and chlorogenic acids. These compounds help combat oxidative stress and inflammation, both of which play a role in the development and progression of prostate cancer. Additionally, coffee drinkers may benefit from a reduced risk of other metabolic conditions that can indirectly influence cancer risk, making coffee a potentially valuable dietary component for prostate health. 2. Improved outcomes in prostate cancer patients. For men already diagnosed with prostate cancer, regular coffee consumption may be associated with better outcomes. Studies have shown that coffee drinkers may experience slower disease progression and improved survival rates, particularly in cases of aggressive prostate cancer. These benefits are likely linked to coffee's role in enhancing metabolic health, reducing inflammation, and improving insulin sensitivity, which are all factors known to influence cancer growth. While more research is needed, these findings suggest that incorporating coffee into a balanced diet could provide added support for managing prostate cancer. 3. Anti-obstruction properties. Chronic inflammation is a major risk factor for prostate issues, including prostate cancer and prostatitis. Coffee contains potent anti-inflammatory compounds that may help reduce inflammation in the prostate gland and surrounding tissues. These compounds work by neutralizing harmful free radicals and regulating inflammatory pathways in the body. For men with a history of inflammation prostate conditions, moderate coffee consumption could offer some protective benefits by promoting a healthier inflammatory response and reducing the likelihood of tissue damage. 4. Enhanced prostate health through improved metabolism. Coffee's ability to improve insulin sensitivity and lower the risk of diabetes also contributes to better overall prostate health. High insulin levels and metabolic disorders are associated with an increased risk of prostate enlargement and other complications. By regulating blood sugar levels and improving metabolic function, coffee may help reduce the risk of developing these conditions. This enhanced metabolic health also supports the prostate's ability to function optimally and resist stressors that could lead to disease. 5. Urinary tract health. Moderate coffee consumption can support urinary tract health due to its mild diuretic effects, which encourage healthy urination and help flush out toxins. By promoting better urinary flow, coffee may indirectly reduce the risk of urinary retention, a common issue associated with prostate enlargement. This cleansing effect helps maintain a healthier urinary system, potentially reducing irritation and inflammation in the prostate over time. However, balancing coffee intake with adequate hydration is key to maximizing these benefits without causing dehydration. 10. Tips for coffee consumption and prostate health. Here are 10 tips to get the most of coffee consumption when it comes to prostate health. By incorporating these tips alongside moderation, hydration, and mindful consumption, you can optimize the health benefits of coffee while minimizing any potential risks to your prostate. 1. Moderation is key. When it comes to coffee consumption and prostate health, moderation is essential. Research indicates that drinking 2 to 3 cups of coffee per day may offer protective benefits for the prostate without triggering adverse effects. Consuming more than this can lead to issues like bladder irritation, dehydration, or hormonal imbalances, particularly in men with pre-existing prostate conditions. Sticking to moderate intake allows you to enjoy coffee's anti-inflammatory and antioxidant properties while minimizing potential risks. It's also wise to monitor your overall caffeine consumption from other sources like tea, energy drinks, or soda to ensure you stay within safe limits. 2. Avoid additives. While coffee itself may offer health benefits, the additives commonly included in coffee beverages can undermine these advantages. Sugary syrups, heavy creams, and artificial sweeteners not only add empty calories, but also increase the risk of weight gain, insulin resistance, and metabolic disorders, all of which can negatively impact prostate health. For a healthier choice, stick to black coffee or use small amounts of natural alternatives like almond milk or a touch of honey. Avoiding high-calorie additives ensures that your coffee remains a beneficial part of your diet without contributing to long-term health risks. 3. Listen to your body. Your body is the best indicator of whether coffee consumption is benefiting or harming your prostate health. If you experience worsening urinary symptoms, such as frequent urination, urgency, or discomfort, it may be a sign that your body is sensitive to caffeine. Men with conditions like BPH or prostatitis should pay close attention to how coffee affects them. In such cases, reducing your coffee intake or switching to decaffeinated options can help minimize irritation while still allowing you to enjoy the flavor and routine of coffee. Always prioritize how you feel and adjust your habits accordingly. 4. Stay hydrated. Coffee's natural diuretic properties can lead to increased urination, which, if not balanced with proper hydration, can result in dehydration. Dehydration can worsen urinary symptoms and contribute to bladder irritation, making it essential to drink plenty of water throughout the day. For every cup of coffee consumed, consider drinking an equal amount of water to maintain hydration. Proper hydration supports the urinary system and reduces the likelihood of discomfort or inflammation in the prostate. Keeping a water bottle handy can make it easier to maintain this balance and support overall health. 5. Opt for organic coffee. Choosing organic coffee can reduce your exposure to harmful chemicals like pesticides and herbicides that are sometimes used in conventional coffee production. These chemicals may contribute to oxidative stress and inflammation, which can negatively impact prostate health over time. Organic coffee is grown without synthetic chemicals, making it a healthier option for your body and the environment. 6. Time your coffee intake. When you drink coffee can make a difference for your health. Avoid consuming coffee late in the day, as it may disrupt your sleep patterns. Poor sleep quality has been linked to hormonal imbalances and inflammation, which can affect prostate health. Drinking coffee in the morning or early afternoon ensures you get its benefits without compromising your rest and recovery. 7. Experiment with decaffeinated coffee. If you're sensitive to caffeine or have been advised to limit your intake, decaffeinated coffee can be a great alternative. Decaf retains many of the beneficial antioxidants and anti-inflammatory compounds found in regular coffee while reducing the risk of caffeine side effects such as bladder irritation or increased heart rate. 8. Pair coffee with a healthy diet. Coffee's benefits are best maximized when combined with a balanced, nutrient-rich diet. Foods high in antioxidants such as fruits, vegetables, nuts, and seeds complement coffee's protective effects on the prostate. Incorporating healthy fats, lean protein, and whole grains can further support prostate health and overall well-being. 9. Limit coffee before physical activity. For men with urinary symptoms or prostate concerns, drinking coffee right before exercise can increase bladder urgency and discomfort during workouts. To avoid interruptions, plan your coffee intake for after your activity or ensure it's consumed well in advance of physical exertion. 10. Consult a healthcare provider. If you're unsure about how coffee might affect your prostate health, consult a healthcare professional. They can provide personalized advice based on your medical history and specific conditions, such as BPH, prostatitis, or prostate cancer. Regular checkups also ensure you stay informed about the best dietary choices for your health. Thank you for watching. If you found this video helpful, be sure to like, subscribe, and share it with others. And don't stop here. Check out our next video, 10 Worst Drinks for Prostate Health, to learn which beverages you should avoid to keep your prostate in top shape. See you there!